Right, thanks very much indeed. The Truth About Social Care, it's a great title. And I think it's absolutely the right title because it's high time that the truth was told. But if you bear with me, I want to start with history, because understanding where social care has come from is really an important part of understanding where social care is today. And forgive me, those of you that have heard this before, but I think it's important that people that haven't heard it do hear it. Social care as it is today goes back to 1948 and the 1948 settlement. It was part of the welfare state, created largely by Clement Attlee and Nye Bevan. Hands up anyone who doesn't know who those two are. Right, they're very famous people. Now, Nye Bevan, we'll focus on the NHS to begin with, because that was and has remained the jewel in the crown of the welfare state. It's as valued now as it was then. Now, when the NHS was set up, and since, Nye Bevan was Minister of Health, and he's been generally described as the father of the NHS. It was his work that brought it all into being. But if he was the father, the grandfather was Clement Attlee. Now, not many people know that Clement Attlee was actually a social worker. He forsook a lucrative career as a family solicitor, went to work in the East End as a young man, working with young people, and stayed a social worker through to the First World War, became a lecturer at the LSE in social work, and published a book in 1920 called The Social Worker. And in it, he espoused his philosophy, which really laid the foundations for the welfare state, and in particular for the NHS. And that was based on a rejection of the concept of charity as the basis for care provision, health and care provision. And the phrase that he used is, he said, not very many people realize that before you can be generous, you must be just. In other words, provision of care, healthcare and support should be based on the concept of justice, of human rights. And as far as healthcare was concerned, it was the right to the best health that the medicine of the day could provide for every individual. So it was Attlee's vision that drove the thinking around the creation of the NHS, which Bevan then picked up. A key principle that Bevan established was that need must come before resource. It was a fundamental principle, because one of the things that he had to do was to fight off the British Medical Association, who were really worried about the NHS and doctors becoming servants of a Stalinist state. So a fundamental principle that he established was that need would come before resource. And in 1948, when the NHS was set up, he wrote to the BMA, and these are his words, because I'm quoting them: "My job is to give you all the resources that I can and leave you alone as professional men and women to use your skill and judgment without political hindrance." It was an unequivocal and clear position that need was a professional responsibility, resources were a political responsibility. If they came apart, then of course you'd get waiting times. And as we know, over the decades, as waiting times grow up, political pressure grows and they come back together again. It might sometimes take a Labour government to succeed a Tory government for that to happen, but over time, it generally does happen. But they didn't apply that principle when it came to social care. And it's easy in hindsight to be critical of that, but the priority of the day politically was to stop the practice of putting older and disabled people into the workhouse, because that's what happened. And the absolute priority was to stop that, and they did. And they transferred responsibility from poor law boards to local authorities. When it came to what those local authorities would actually do, there wasn't the same vision as there was for healthcare. Healthcare, it was clear, the best health that modern medicine could make possible for everybody. There was no such equivalent for the care of old and disabled people in the 1940s. So ending the poor law, ending the use of the workhouse was the absolute priority. Responsibility would transfer to local authorities. When Nye Bevan was asked in Parliament, what would local authorities do and how much would they do? His answer was, as much as our resources allow. Now, if you think about that, that's an exact reversal of the relationship between needs and resources that it established in the NHS. And it had two consequences of doing as much as resources allow. One, it put social care at the end of the queue for public resources, hence the Cinderella status of social care, which always feels like it's getting crumbs from the table. And we've seen that recently with the increase in funding from national insurance. Nobody knows how much social care is going to get, but we suspect it ain't going to be very much. The other was to create a different relationship between the professional and the politicians when it came to identifying need, because need would be defined by the available resource. If there wasn't a resource to meet the need wouldn't exist. And that's the basis of what we have at the core of social work today, which is called the eligibility process. Need exists only if there is resource to meet it. Now, that's what has bedeviled social care for the 7 decades since. And people knew that there was something seriously wrong with social care as early as the 1960s. There was great dissatisfaction. And we've seen a succession over the past 6 decades of attempts to transform social care, none of which have tackled this central question of eligibility and the definition of need according to available resource. It's remained the elephant in the room for 60 years or more. Now, I could talk about some of the transformation strategies, but you don't need to know that for now. If we fast forward to 2014 and the Care Act, that was described by Norman Lamb, who was the Minister for Care at the time, as the single biggest reform in social care for 60 years, i.e. since 1948. And he was right, or at least he should have been right. The reason he was right is because the Care Act introduced 3 important innovations. The first of them was the concept of well-being and the well-being principle. And the Act defined well-being by 9 areas. And those 9 areas, if anybody looks at them, will think, well, if I can tick every box, of every one of those 9 boxes, my life is going to be pretty good. So there isn't much dispute that those 9 areas of well-being are comprehensive and do describe the way life should be for people. That was one. Secondly, it introduced the concept of control, that the principle that people should be in control of their own lives. When it comes to your care and support, nothing could be more important. It's even more important than in healthcare, where we are generally willing to allow the clinician to do what they know best and we don't understand. But when it comes to care and support, it's vital. It's been known for a long time. It's vital that we as an individual are in control of our lives and our support and the effect that that has on our lives. So the Care Act introduced that principle. And then the third one was, for many people, arguably the most important of all, it opened a pathway to the concept of sufficiency of funding to meet all needs. Because the Care Act said local authorities should set their budgets in order to meet the full needs of the people in their community. They should work towards it. So Norman Lamb, as Minister for Care, was perfectly entitled to make his claim that this is the biggest shake-up in social care since 1948. But it hasn't happened. There's still general consensus that it is the right legislation, it is the right thing to happen, but it hasn't happened. And the question is why? Everybody blames everybody else. And this is where the truth begins to come in. Now, with legislation, what happens is that the government then intervenes and issues regulations and statutory guidance which tell local authorities how they want the councils to implement whatever the legislation is. And in relation to the Care Act, we have what are called the eligibility regulations and the statutory guidance. Now, what they do is this. The government basically says, we're going to have utopia. So what they say is, firstly, whilst the Care Act made it possible for councils to say if their resources were not meeting every need for well-being, the guidance rejected that notion. The Care Act created two groups of needs: those which are a legal duty to meet, which should be like the blue light service. You know, if your life is at risk, the ambulance comes out and there's no questions about cost, it's done. And those that are a power to meet. Now, the importance of that is that if local authorities are to work towards having sufficient funding to meet all needs in the community, they must know what all needs are in their community. They must be free to identify them, and they must be able to say, we haven't got the resource to meet this level of need. And then the political pressure is on, as with waiting times in the NHS, to create the funding that's actually required. But one of the first things that the statutory guidance did was to say, well, we're going to continue as we've always done, and make the duty, the legal duty to meet need, the total offer that councils are going to make. Now that's okay, because what they then said is that councils must regard themselves having to have a legal duty to meet any need which has a significant impact on the well-being of the individual. And it goes on to say that in determining whether or not the impact is significant, then the council must have regard to what is important to the person. So in other words, what the government was saying was that councils have got to meet every need that is important to the individual. Then they also said that they must set budgets to meet every need in the community. Quite simply, that's what the statutory guidance says, that councils must set a budget that's sufficient to meet, quotes, the needs of their entire population. Now, under those circumstances, of course, everything would work perfectly well. The council has got enough money to meet every single need, so they identify every need important to everybody and they meet it. But of course, it just doesn't happen. Councils cannot set budgets in that way for all sorts of reasons. They can't set the budget in that way because, for one, they're dependent on the government for funding. They don't know how much they're going to get. They're limited in how much money they can raise through local taxes. They can't raise whatever they think is necessary. And they've got other services that they have to provide for. And there's no expectation, there's no requirement that those services stand back and allow social care to have all the money it requires before they then divvy up the rest. It just doesn't happen. So there is no way that any council in the country can set a budget sufficient to meet all needs for well-being in their community. In other words, the government has set an impossible task for local councils. And they do that in the knowledge that the prevailing system for balancing needs and resources can be persisted with. And the political advantage of that, the political advantage of the 1948 settlement, is whatever money the councils receive, whatever money the government gives to councils, is always enough. Because what councils do is they reduce the need to the level of resource. Now, to political parties, in a field that's as worrying for them as social care, where they worry about the fiscal risk, that's a gift from heaven. Thank you very much. Whatever budget we set, you as professionals are going to make that work for us. Thank you very much. It's the exact fear that the BMA had in 1948 that Bevan made sure would never come to pass. The professionals in social care do the bidding of the political process. And we've got lots of evidence to demonstrate that's true. The logic of it is clear. and the pattern of spending consistently follows the budget. So the government effectively stymied the Care Act. They should have issued guidance which said that the duty to meet need will be a blue light minimum guarantee. They should have advised councils that they must identify all needs for well-being, that they have the ability to say when they can't afford to meet need, and they should be under a duty to report all unmet need to government, so that national budgets and local budgets are set to ensure that there is no funding gap. None of that has happened. So then we come to Barnet. And as Terza said, it's about 2 or 3 years ago now that I got involved in Barnet, who basically gave the game away. They made a decision, and it was self-evident what was going on, because within the context of the Care Act, what councils do is claim to be delivering the Care Act. It's an enormous deception that's being exercised up and down the country, basically by all councils, who all claim that they are delivering the Care Act. They all claim that they are following the same eligibility criteria of meeting every need that's important to each individual in terms of the impact on their well-being. They all claim the same. None of them are doing it. None of them could do it. And what Barnet did was demonstrate how that works in practice, because they made a cut to their budget of nearly £500,000 on the premise, once they were challenged by Terza and her group, that once people who were able to be supported at home knew that they could go into residential care instead, they would choose residential care, and it would be sufficient in number. It was around 38. I made a Freedom of Information request to ask them actually where they got this figure from, and it was purely a financial calculation. They were given the figure, it was £424,000 to save. They divided that by the amount that would be saved if people went into residential care rather than be supported at home, and came up with a figure of 38. Well, you only have to think about that for about 5 seconds to realise it is an absurd suggestion that anybody who is in need of substantial support would choose residential care, give up their home, give up their identity, give up their independence. Not just that, but also face huge costs, because once you go into residential care, all of your wealth becomes liable to be charged, so you lose your home. It was a nonsensical decision. But what that did was set what's now known as the Barnet Forum for Independent Living. It set us with the Labour group on course to thoroughly investigate the way Barnet Council works. And we think we've now got to the position where we've got their number. We have worked it out. It's not easy to do, because there are enormous and elaborate deceptions that throw people off the scent. But basically, we've established, I think beyond any reasonable doubt, that whereas Barnet says that it doesn't take resources into account when it assesses need, that it does. It says it doesn't because it says the social worker is the person that makes all the decisions about whether a need will be met, and if so, how a need will be met. But then we discovered that the social worker has to submit their decision for approval to a senior manager. Now, we were told that the approval is no more than a light touch quality assurance check. But that is beyond belief. It's entirely disingenuous, because the senior manager, one, has the information about the extent to which the budget can sustain meeting a need. Two, they have responsibility for the budget, whereas a social worker doesn't. Three, they have managerial authority over the social worker. So it beggars belief to think that the social worker makes a decision and the manager merely signs it off. Similarly, it wasn't just the 424k that was going to be saved in 2019, but we've counted up 12 such similar cuts over the past 4 years totaling £3.5 million worth of cuts. All of them are on entirely spurious grounds, unevidenced, but they're made in the confident knowledge that if they're not made in the win-win scenario of people being more independent or whatever else it might be, that money will be saved by the front line, because the front line is under pressure to spend according to their budgets. And given that their budgets are not enough to meet all need, the only way that they can match spend to budget, which by and large they do year in, year out, is to adjust the level of need that will be met according to the budget. So year in, year out, the budget is cut, and the consequence is salami slice cuts of sufficient size to sufficient number of people whose names are never known. It happens day by day until the new level of budget has been secured. So we're now at the position, the Barnet Forum is now at the position where we are basically putting the finishing touches to a dossier. It's a dossier of the way Barnet works. A lot of it consists of work that the Labour group has done in challenging the director. A lot of it is work that we have done ourselves in challenging senior staff, examination of processes. I'm pretty confident that it's a very competent piece of work. It's a very solid piece of work. I've likened it a bit to David and Goliath and thought, well, this is the stone that could find the weakness in Goliath. I might be overstating it, I might be over dramatizing it, but that's just how it feels, because it feels like a Goliath. It's not just this council which refuses to discuss these issues. Nobody wants to know. It's all other councils. It's the local government association. It's the government itself. So it's a major piece of work to try and make this stone hit home. But that's what we're going to try and do. It's major. We need to find heavyweight support, and we're beginning to put feelers out. I've got a meeting next week with the Equalities and Human Rights Commission, because we actually believe that what's happening in England, because it's systemic, because it's every council, and because it's coming from the government, that what this is actually doing is violating the UK government's commitment to the United Nations Convention on the Rights of Persons with Disabilities, Article 19, independent living. Because independent living, as defined by the United Nations, is basically well-being by any other name. So we think that there is a very strong case that we might be able to use to rattle the cage of the establishment, but nobody should be under any illusions about just how difficult it's going to be and how hard it's going to be to get allies along the way.
Yeah.
So I've probably spoken enough, because I suspect you've got questions. So shall I stop there, Terza? Oh, I didn't mention, sorry, no, I can't stop there. How can I stop there? I've only mentioned one of our two campaign strategies. So sorry, I can't stop there. Of course I can't. Because the other one is work that we're doing, mostly now led by Charlie, I have to say, to make it possible for individuals to challenge their local authority themselves. This is a website which will tell people, take them through the process and say, look, councils don't work in the way they should. If you assess your own needs in the way that the Care Act actually says, you will stand a terrific chance of imposing your own assessment of your needs on the council. There's been talk for years about self-assessment and how important it is empowering people, but it's never got beyond talk. This takes it beyond talk. So what Charlie's website will do, there's still work to be done to get it in the best shape possible. What Charlie's work will do is to take people through the process. And if they can find the perseverance to do that, then they will have a self-assessment which they can take to their council and say, basically, you've got to try and better this, because we're pretty confident that this is actually compliant with the Care Act. You say you're compliant with the Care Act, well, this is it. And if you can't better it, if you come up with something different that I don't think is right, I think I'm going to have a very strong case to take to the Ombudsman, because you will. And there is an increasing track record of the Ombudsman finding in favour of people who have argued their case well. So there are two strands to the forum's strategy for change. The first one I mentioned is changing the way the government works, but that is a long haul. That's not going to be quick. You can be sure, we can be sure of that. But the other one, the website to empower individuals, we really hope that that's going to start having an impact fairly quickly.